Hey, Dr. Dunaway here with Chiro Strength, and in today's video what I wanted to discuss was the blog that we had about shoulder pain. Shoulder pain is a topic that I could go on for days about because it's very poorly managed and people underestimate how much damage and the down-term effects of living with shoulder pain. And it's very important if you have shoulder pain to make sure you get assessed and figure out what's going on, because the fix, although it's not easy to do, the idea behind it's simple. So I'm going to give you a few tips to work with it. But like I said, don't play around with shoulder pain because it can turn into a doozy pretty quickly and get you on the operating table kind of out of nowhere. So shoulder pain, more than any other injury, is about what not to do outside of treatment. So when I tell people to not pick the scab in between visits, what I'm saying is make sure you're not doing the stuff that's overloading the tissue that's really simple to fix. And it takes some mindful moving to do this. But when I see people with pulling patterns with shoulder pain, I just have this band anchored, and when you see people pull, you'll see their shoulder come up like this. They can't activate this lat to hold that shoulder down and really brace with the core, brace with the lats, and use this nice, solid lat and serratus and all these support muscles for the shoulder to hold the shoulder down and lock it in. And they rely on these upper traps that are always tight and stiff because they're doing too much to start this motion. So that's really important. Anytime you're pushing, anytime you're pulling, anytime you're carrying, make sure you get this lat, boom, activated, and those shoulders don't ride up on you like this. So I see that a lot with rows. The shoulders come up like this during rows, and I see that a lot with pushing, and people push, a bench press or something like that, shoulder will come forward like this. So make sure, get the lats activated, and push and pull from the armpits is what I tell people. Another little drill is called the arm bar. And this is going to be an activation drill. And so with this arm bar, what it is a good way to help stabilize the shoulder. So you get in this position here, my arm and leg are in one line, and all I'm going to do is slowly come over, holding this bell right above my head, and I'm going to try and stable that. So if it starts shaking, you know your stability is lacking. But I'm going to try and just do a little internal, external rotation. And then once I feel like I have good stability with that, I'm going to slowly start trying to pull my elbow into my back right pocket. And this is called a crooked arm bar. And so this is really going to activate the lat, really force you to turn off the upper trap and really turn on a lot of the support muscles there behind the shoulder blade. And then to get this out, you're going to brace real tight and slowly push up. And again, you're using a pretty light weight with this. So that was an example of the arm bar and crooked arm bar, which are both really good drills to work on the stability of the shoulder. Far too often with shoulder pain, people want to stretch and stretch and stretch. If you do that, that's fine, but follow it up with some stability stuff. Quadruped crawling is really important, or a really good drill to kind of help support shoulder stability. And we talked about in past videos. Stretches to keep in mind with the shoulder is making sure the pecs are stretched out and making sure that thoracic spine is mobile. So we've also had videos in the past about thoracic spine extension rotation. So keep a look at some of those things. Make sure you're not just trying to stretch that shoulder out, because a lot of times you're going to put yourself in a position or a higher risk for more injury. So if you have any questions about this topic, please shoot me a message on Facebook. Put some in the comments below this video, and I'll be sure to answer those questions. And again, this is Dr. Dunaway with Chiro Strength saying, don't just mend, transcend. Thanks.